So the most important question is that what is the second prescription, and before going to the second prescription we must know what is the first prescription, because second prescription definition is simply that the prescription after the first one. Okay, so you must know what is the first prescription. First prescription should be the medicine, not a placebo, and it has produced some changes on the body of organism or affected on the body of organism, and most importantly it should be the correct one. Okay, so this is the simple definition of the first prescription, and second prescription is simply the prescription after first one has acted or affected some changes on the body of organism. First type of the second prescription is the repetition of the first prescription, and when you are going to repeat your first prescription, when the medicine you had given previously has stopped doing its work and the case comes to the standstill position and the patient is not further improving. Okay, or when you have given the first prescription but partial relief of the symptoms, the original symptoms for which you have given the first prescription, they reappear. In both the cases you are about to repeat your first prescription. Alright, so this is the type of the second prescription. Okay, next type is antidote to the first prescription, and when you are going to antidote your first prescription, when there are new symptoms appear in the body but these symptoms not correspond to the old symptoms or the previous symptoms for which you have provided the first prescription. These symptoms are of the medicine you had given in that case as a first prescription. Alright, so in that case what you have to do in the second prescription, you have to antidote that first prescription. This is the type of the second prescription. Alright, so the next one is the type that is the change of the remedy, and when you will change the remedy, when for what symptoms you have provided the first prescription. Okay, these base of symptoms totally changed, and for that you have to change the remedy, but it is mentioned that before changing that remedy you must move on to the highest potency of that remedy before leaving that remedy. Okay, next one is the complementary to the first prescription. Complementary is simply the change of the remedy. Okay, and it is basically used when the first prescription is acute one and you have to give the complete cure to the patient. You move on to the complementary medicine of that acute one, that is the chronic one, and for the completion of the cure. So this is a complementary to the first prescription. Next one is a cognate. Okay, so cognate is simply closely related to each other. When you give one medicine to the patient for one symptom, and after that symptom subside, there is a need for the another remedy which is closely related to the previous one. So this is a cognate. Okay, next one is the change of plan of treatment, and you will change your plan of treatment when the miasm is changed. Okay, for one miasm you have provided that medicine, and totally the miasm of the patient is changed, so you are about to change the plan of treatment.